Did you know that certain breast conditions can affect breastfeeding? Today, we'll dive into this topic. Breastfeeding is an essential process, providing the ideal source of nutrition for infants in their first 6 months. It's a natural act, but it's not always without challenges. Certain breast conditions can arise, making breastfeeding uncomfortable or even painful for some mothers. These conditions can range from flat and inverted nipples to full and engorged breasts, blocked ducts, mastitis, sore nipples, nipple fissures, and even Candida infections. Recognizing, diagnosing, and managing these conditions is crucial not only to relieve mothers of discomfort, but also to ensure successful breastfeeding. Treatment may differ depending on the specific condition and the mother's health status. As we delve into each of these conditions, remember that understanding them is the first step towards effective management. Let's begin by discussing some of the most common breast conditions you might encounter. First up, we have flat and inverted nipples. These conditions refer to nipples that do not protrude as much as they typically would, or at all. Now, this can sometimes pose a challenge when it comes to breastfeeding, but it's important to remember that the baby suckles from the breast, not just the nipple. In fact, many mothers with flat or inverted nipples find that their condition improves around the time of delivery without any treatment. That's because your body is naturally preparing for the breastfeeding process. So, if you're worried about this, take a deep breath and remember that help is most important soon after delivery when the baby starts breastfeeding. Now, building the mother's confidence is crucial in these situations. It's about understanding that with patience and persistence, you can succeed. In the week or two after delivery, your breasts will become softer, making it easier for your baby to latch on. A key part of managing flat and inverted nipples is ensuring a good breastfeeding position. If a baby is not attaching well by himself, adjusting his position can often help. Sometimes simply trying a different breastfeeding position, like the underarm position, can make it easier for the baby to latch on. There may be times, especially in the first week or two, when a baby cannot suckle effectively. In these instances, expressing milk and feeding it to the baby by cup can be helpful. Expressing milk not only helps keep the breast soft, making it easier for the baby to latch on, but it also helps maintain the milk supply. And here's an important note. Avoid using a bottle during this time as it can make it more difficult for the baby to take the breast later on. For inverted nipples specifically, there's a technique involving a 20 milliliter syringe that can be used to create suction and draw out the nipple. This can assist in postnatal treatment and help a baby attach to the breast. Remember, success in breastfeeding with flat or inverted nipples is possible with patience and the right techniques. Next, we're looking at full and engorged breasts. Now, full and engorged breasts are a common condition that many breastfeeding mothers experience. It typically occurs when you're making more milk than your baby is consuming. This can happen for a variety of reasons. Perhaps your baby is not feeding often enough, or maybe they're not latching on correctly. The result is a buildup of milk, causing the breast to feel hard, painful, and uncomfortably full. The symptoms of engorgement can make breastfeeding more challenging. Your breasts might feel firm or swollen, and the skin may appear shiny or stretched. Sometimes there can be a low-grade fever, and in severe cases, engorgement can lead to other conditions like blocked ducts or mastitis. But don't worry, managing this condition can be straightforward with a few simple strategies. First, ensure that your baby is feeding regularly and latching on correctly. This will help to empty the breasts and prevent milk from building up. If you're unsure about your baby's latch, don't hesitate to seek help from a lactation consultant or a healthcare professional. In addition to regular feeding, you can also try expressing a little milk either by hand or with a breast pump to relieve the pressure. Remember, the goal is not to empty the breast completely, but to alleviate the discomfort. Warm compresses before feeding can help to soften the breasts and stimulate milk flow. On the other hand, cold compresses or ice packs used after feeding can reduce swelling and alleviate pain. Massaging the breasts gently can also help. Start from the armpit area and work your way towards the nipple. This can help to move the milk down and ease engorgement. And finally, ensure you're wearing a well-fitted supportive bra. But avoid bras that are too tight, as they can contribute to blocked ducts. Remember, while engorgement can be uncomfortable, it's usually temporary. With the right management techniques, it can be quickly resolved. Managing full and engorged breasts can make your breastfeeding journey much more comfortable. Now let's talk about blocked ducts and mastitis. These are two common breastfeeding conditions that can cause significant discomfort for new mothers. Blocked ducts occur when the milk in your breast isn't draining properly. This can lead to a buildup of milk, causing a lump or a hardened area in the breast, often accompanied by pain and inflammation. The skin over the affected area might appear red or feel warm to touch. Now, if a blocked duct isn't resolved quickly, it can lead to an infection in the breast, a condition known as mastitis. Mastitis causes similar symptoms to blocked ducts, but they are usually more severe and may also include flu-like symptoms such as fever and chills. Both blocked ducts and mastitis can affect your breastfeeding journey. They can make feeding painful and daunting, and if left untreated, they can diminish your milk supply. But don't worry, there are various treatment options available. For blocked ducts, the first line of action is often self-care measures. Frequent nursing or pumping, warm compresses, and gentle massage can help clear the blockage and alleviate the discomfort. For mastitis, however, it's important to seek medical help, as it often requires antibiotic treatment. While waiting for the medication to take effect, continuing to breastfeed or pump can help clear the infection and keep your milk supply up. Remember, while these conditions can be painful and challenging, they are typically short-lived. With the right care and treatment, you can quickly overcome these hurdles and continue your breastfeeding journey. So if you notice any signs of blocked ducts or mastitis, don't hesitate to reach out to your healthcare provider. They can guide you through the necessary steps to alleviate your symptoms and ensure you and your baby continue to have a beneficial breastfeeding experience. Being aware of these conditions and their treatments can help ensure a smoother breastfeeding experience. Sore nipples and nipple fissures are other conditions you might come across. These are common issues many face in their breastfeeding journey. Sore nipples are often a result of improper latching by the baby or due to the baby's tongue tie. In contrast, nipple fissures are small cracks or tears on the nipple skin, typically caused by dryness or friction. These conditions can make breastfeeding uncomfortable, even painful, and may discourage some from continuing this natural and beneficial practice. But don't worry, there are several solutions and preventive measures to tackle these issues. Firstly, ensure the baby is latching correctly. This means the baby's mouth should cover more than just the nipple, ideally a good part of the areola. If you're unsure, reach out to a lactation consultant or your healthcare provider. Next, maintain good nipple hygiene. Clean them gently with warm water, avoiding soaps or harsh cleansers that can cause dryness. Applying a nipple cream or lanolin can help keep the area moisturized and promote healing. If you're dealing with fissures, it's important to give your nipples time to heal. You can do this by alternating between breasts during feeds or expressing milk and bottle feeding for a short period. Lastly, wearing the right bra can make a world of difference. Opt for a comfortable, well-fitted nursing bra made of breathable fabric to reduce friction and provide necessary support. Proper care and management can help alleviate the discomfort caused by these conditions. Last but not least, let's delve into Candida infection. Candida is a type of yeast that can cause an infection in the nipples and breast tissue. This condition, often referred to as thrush, can cause significant discomfort for breastfeeding mothers. The symptoms of a Candida infection can vary but often include persistent burning pain in the nipples or breasts, often after a period of pain-free breastfeeding. Some women may also notice shiny or flaky skin on the nipple or areola, and in severe cases there may be visible signs of redness or swelling. Candida can affect breastfeeding in several ways. The pain and discomfort can make it difficult for mothers to continue breastfeeding, and the infection can also pass back and forth between the mother and baby during feeds. The baby might develop white patches in the mouth or a diaper rash, indicating a yeast infection. If you suspect a Candida infection, it's crucial to seek medical help promptly. Treatment usually involves a topical antifungal medication applied to the nipple area after each feed. In some cases, oral medication may also be necessary. Additionally, because Candida can be passed between mother and baby, the baby may also require treatment to prevent reinfection. It's also important to note that while over-the-counter treatments are available, a healthcare professional should always confirm a diagnosis of Candida. This is because other conditions can mimic the symptoms of Candida, and appropriate treatment depends on accurate diagnosis. Understanding and treating Candida infections can greatly improve your breastfeeding experience. Now that we've covered various breast conditions related to breastfeeding, let's take a moment to recap and offer some self-care tips for breastfeeding mothers. In this journey, remember that your comfort and health are just as important as your baby's nourishment. You can manage many of these conditions at home with simple remedies, but always consult a healthcare professional for a proper diagnosis and treatment plan. For flat and inverted nipples, try nipple stimulation or a nipple shield. For full and engorged breasts, regular breastfeeding or pumping and warm compresses may help. Blocked ducts and mastitis may be relieved by frequent feeding, warm compresses, and gentle massages. Sore nipples and nipple fissures can be managed with proper latch techniques, nipple cream, and allowing your nipples to air dry after feeds. And for Candida infections, antifungal medications and keeping the nipple area clean and dry can be effective. Remember, breastfeeding is a journey, and it's okay to ask for help when you need it. Reach out to lactation consultants, healthcare providers, or support groups for advice and reassurance. You are not alone in this journey, and countless mothers have faced and overcome these challenges. We've covered a lot of ground on breast conditions related to breastfeeding, from flat and inverted nipples to full and engorged breasts, from blocked ducts and mastitis to sore nipples and nipple fissures, and finally, the Candida infection. Each of these conditions presents its own challenges but also has its own solutions. The key takeaway here is that these conditions are not uncommon, and there are ways to manage them effectively. It's important to diagnose and treat these conditions not only to relieve discomfort and pain, but also to ensure that breastfeeding can continue smoothly. Remember, treatment may vary based on different factors such as whether the mother is HIV infected. So it's crucial to seek professional medical advice tailored to your specific circumstances. Breastfeeding is a journey, and like any journey it may come with its own set of bumps along the road. But with patience, persistence, and the right guidance, these bumps can be navigated successfully. Remember, every breastfeeding journey is unique, and it's okay to seek help when you need it. Did any of these conditions resonate with your experience? Share in the comments below.